is Dr. Morris, and I just wanted to record my last message to you for the semester. I have had a ball teaching you as your faculty, and I have really enjoyed watching how you all have embraced the concept of innovation. And I have to tell you that as I was reading Module 7's discussions about your ideas for innovation, I am very inspired. You all have some phenomenal ideas for innovation. I clustered them into 4 broad categories. So the first category or theme that I saw emerge from your innovations, it really related to innovating organizational structure. And Javier gave a great example to illustrate this concept when he talked about his idea for innovating how the medevac team is comprised to add a registered nurse to the team, and kind of what the impact of that would be on patient care and transporting patients. And so that was just a great example of an organizational innovation that really looked at the structure of the organization. And then several of you really looked at innovating, either changing or enhancing processes. And some of the examples that I selected to illustrate this category, one was Irma's innovation about looking at the idea of family-centered rounding. The second would be Tara's innovation, talking about bedside rounding and what the value of that would be and how that could be implemented. And then the third example would be Siobhan's ideas about how to decrease hospital waste. So again, great topics to illustrate this category of innovation. And then the third category of innovation, it related to education, and it was education from 2 different perspectives. So one perspective was looking at innovation from the idea of what do we, and I talk of we as nurse educators or health educators, need to do to make sure that current health educators as well as future nurses and health educators are aware of the different concepts of innovation and what it takes to be an innovative leader. And so that really came from both Brooke and Brianne, their ideas about how to integrate that information into curricula at different levels. Kelly had a really novel innovation and looking at, again, kind of that same theme about how do we prepare nurses to be innovators, but she took it a level further, and she was really looking at defining the different types of thinking skills that nurses need to be great innovators. And so that was an excellent example. And then the last example in this category, it was from Mary, and Mary talked about the idea of implementing simulation or high fidelity simulation into different educational programs as a means to help better prepare both our current workforce as well as our future workforce. I won't limit it to just nursing because it's more than just us. And then our 4th category of innovation, it really looked at using technology, either current technology or creating new technology, and using it in different ways. And so several students had some excellent ideas about how they could either create apps or either use existing apps in new ways. And so some of these ideas came from Dominique, Debbie, and Martha. And they really spoke to using apps for self-management for chronic diseases, or to help track and report symptoms to the healthcare provider, as well as using apps for patient education. And then Jennifer talked about using an existing technology, so using existing Bluetooth technology as a different way to help connect with the current hardwired telemetry monitors that patients wear, and how that kind of impedes a patient's ability to move about and things. And so using Bluetooth would be a great way to, I call it, untether the patient. So no pun intended, but anyhow, so that's again another great idea. And then Marcus really reminded us all kind of an overview picture of just how important the role of data is, and evidence, and risk-taking. And I think some of the rest of the class talked about the role of risk-taking and being an innovator as well, and being able to step forward and willing to take that risk. And so excellent ideas about innovation, and it was a tremendously fun discussion to read as your instructor. I am going to post a link for you for an article that that I read. It's about a nurse practitioner who received some funding from the American Nurses Association to launch her innovation. And her innovation, it was an instructional dermatology surface models. And so she's an advanced practice nurse, and she was looking at some type of an app or a tool to help diagnose people with skin cancer. And the reason why I share this is because it's very important, not only one, because it recognizes the work of a nurse innovator, but also because it recognizes that, that nursing organizations, such as, in this case, it's the American Nurses Association, that they're actually providing grant funding and different types of funding incentives to nurses to go forth and launch their innovations. And so it's really an important article for those two reasons. And then last but not least, I need to give you my summary for Module 8, which is really, as we conclude this course, I just need to again reiterate how impressed I have been with each and every one of your discussions throughout the session. I've learned a lot from you all. You have some phenomenal ideas. It's been fun to watch how you've discussed how you would implement the different concepts and apply them into your work settings. And so I've greatly enjoyed that. And then last but not least, I want to tell you that one thing as a faculty is that we love hearing back from students. You may not know that about us, but we do. And so please reach out to me. Let me know about your career journey, where it takes you, what your accomplishments are, because I absolutely love to hear that. And then the other piece of information that goes hand in hand with that is, please know that as your faculty member, I am very committed to your success. If there's a way that I can help facilitate your career journey in the future, please let me know. A lot of times students reach out to me and ask me to serve as a reference for them if they're interested in pursuing graduate education. That's something I'm always happy to do for any of you. So anyhow, including, just know that even though I won't be your faculty anymore for this course and you're done, woohoo, big yay, but please know that I'm here to help facilitate your journey into the nursing world and wherever that may lead you. And it has been my pleasure to be your faculty. So best wishes as you finish the RN BSN program. Since we are in December, I'm going to say happy holidays and enjoy the holiday season. Thank you. Bye-bye.